Hi, my name is Debbie Komisak. I'm doing this video presentation on the continuum of care. The continuum of care, as I see it, starts with a patient who has specific needs and follows through with that patient, making sure he or she gets the proper level of services needed to improve or maintain their health. It is a comprehensive approach to ensure benefits and outcomes for the patient. For example, a patient from the doctor's office to the home, or another example is a traumatic hospitalization to a rehabilitation center to the home. I work in a large pediatric clinic. I don't feel we have a dedicated program to help with the continuum of care. I do help in some degree in part of my role in doing ER and urgent care follow-ups to make sure that out of the patients that visit these facilities, they are being evaluated and see if it is recommended they follow up in the office after their visit to the emergency room, for example. Management is also in the process of developing a care coordination department. They recently hired a nurse to manage this department, but she is unsure of exactly what she is to be doing. I don't feel there is a sound leadership in my organization in that department of continuity of care. The hope is the care coordinator will oversee especially the special needs and complex case children and make sure they have the proper DMEs, and if they need nursing staff or home health aid services in the home, that is all coordinated. Also, this care coordinator would make sure they are getting their scheduled visits. The new continuum of care case management positions can be very useful in our organization, primarily for the health and well-being of the patient. Many of our families are in the low socioeconomic class, and some are non-compliant as far as getting well checks, getting immunizations, coming in for their appointments, their no-shows, a lot of them. They may not have the education or understanding the importance of the care for their children. Having a case manager can help these families through education and advising them on the availability of services that they may need or may be available to them in our community. I feel the bottom line is having the service in the practice will be beneficial to the patients and the practice. Better consistent care will be realized in the community by word of mouth, and families will be grateful. This in turn will increase the patients wanting to be seen in this practice and creating more revenue. Quality indicators that influence the quality of care would be efficiency. In a practice such as where I work, being in a clinic or a hospital, efficiency is necessary. This is important for people, patients who are being treated, because they want the most time out of the provider or nurse as they feel they want their money's worth. Working efficiently allows one to have sufficient time with the patient by being organized and punctual, so they could spend quality time with each patient. The efficient care and services should also be cost effective, and waste should be decreased. The practice of linking hospital reimbursement to performance outcomes could be explained as the term pay for performance, which is used to improve the quality and efficiency of overall health or overall health care. The hospital is to be reimbursed by the insurance companies and provide optimal patient care, and they expect that, and the providers are giving financial incentives to accomplish this. This helps both the patient being given quality care so their health is at its best, and the provider can get rewarded financially to provide that quality care that the patient should have.